the people here tonight from the Massachusetts Department of Public Health, Mark Nascarella, who is the Director of Environmental Toxicology. We have a bunch of DEP people here. DEP, this is not all of the DEP people working on this case. There's a lot of effort going on. Mark Baldy is the Deputy Regional Director for the Bureau of Wayside Cleanup, which is the lead program for this site. Doug Fine is the Deputy Regional Director for the Bureau of Air and Waste, which has handled the permitting of the Mass Natural Fertilizer facility. Courtney Rainey is our Deputy Chief of Staff and Director of Government Affairs. Kevin Doust is the Section Chief for, I can never remember, his site management. It's a very long title. Paul Vigent is our branch chief in the Bureau of Wayside Cleanup for all the PFAS matters. He's our go-to expert. Rachel Stevens is someone that people have probably met in person. She's been out in the neighborhood speaking with people. She and Paul are our direct contacts with the LSP, and they are getting the most up-to-date information and answering questions that I get, that Courtney gets, and we're able to pass that information along. Deborah Hooper. Thank you. Deborah Hooper is the lead petitioner in what's called a public involvement plan petition. Deb was instrumental in electing up the first group of people to work with us as a group. And with the numbers as large as they are, it's really important to have that conduit who's able to pass along your concerns and questions to MassDEP. And we try to collect all of that up. As Andrea was saying, I talked to Deb about getting sort of categories of questions that we would all try to cover so that you don't have a huge queue of people standing at the microphones later tonight to ask questions. We're hoping to cover all of that. The town administrator has been super helpful. I know Stephanie Latman was planning to be here in person tonight, but couldn't, but she is on the Zoom, and Stephanie was really helpful in getting us to be here in the school, so we appreciate that. We are expecting the legislative delegation this evening. Senator Goby, Senator Cronin, Representative Ferguson, and Representative Slotnick. Should we wait?
Senator Cronin has joined us, but
So
we'll wait everyone else.
So, oh, okay. So, if you wanted to make some remarks, or we can hold and hold. Okay, super. And for Rep. Ferguson as well. Did the representative want you to offer any remarks before we started? Okay, great. So, Deborah.
I'd like to thank you all for coming tonight. A special thank you to the supporter for MassDEP, Mass Department of Public Health, and to all of our other leaders who took time to come here tonight. We know this is a very busy time of the year. I just want to thank all the residents who have spent their money to have their wells privately tested. Without this testing, the site cleanup would in no way be as far as long as it is. I'd also like to thank you for sharing information with our neighbors and keeping up to date with any new information you find out. With that being said, I would like to say what I believe many residents are feeling. We are still looking for more open communication from the people responsible for cleaning this up. There is mounting frustration from a lack of communication, whether it be, sorry, my phone's going on, whether it be from an unanswered or delayed email or phone call to not having our questions that we submit in writing be returned to us with answers in writing. We would also like a list of future POET system installation dates so that we can see in real time the progress on getting us safe drinking water. None of us asked for this situation, yet we are the ones who are going to have to deal with it for years to come. In closing, I'd like to again thank the residents for their proactive roles they have played in this situation. If you have questions on the docket for tonight, please make sure you come up during the question and answer session so that they can get answered. For those of you who are now just finding out about this, we invite you to join our Facebook group, which has close to 200 members, or reach out to one of your neighbors, as chances are they're already in it. Let us continue to work together for the safety and well-being of us all. Thank you.
John, could you put up my slides, please? Thank you. So good evening. My name is Mark Nasrell. I'm the Director of Environmental Toxicology at the State Health Department, the Chief Toxicologist there. And for those of you curious about the relationship between the Department of Public Health and DEP, we work closely on sites involving chemical contamination. We coordinate with our environmental regulator to help interpret some of the potential health risks at sites involving chemical contamination. The health department also coordinates closely with the federal toxicologist, ATSDR, the Agency for Toxic Substances and Disease Registry, just like the Department of Environmental Protection works closely with US EPA. So through that work in the Commonwealth, we've been involved in a number of sites involving PFAS contamination. And we've developed some strategies to answer questions and address some of the concerns. And we're involved in a lot of work related to PFAS contamination. And some of the work we've done over the past year is to really surveil and reach out to primary care physicians in the Commonwealth that are treating children, your grandchildren. And one thing we realized is that in a survey of over 700 primary care clinicians in Massachusetts, when asked about PFAS exposure or how to deal with it, they knew very little about it and actually knew very little about environmental contamination. And I don't say that to concern any of you about the ability of your physicians to deal with the struggles you're dealing with environmental contamination, but I use it to say that these issues are extremely complicated. So if you're frustrated, if you feel like you don't fully understand what's going on in terms of environmental contamination, I want you to know we hear that. And we're working with physicians in the Commonwealth, we're working with communities to communicate effective strategies to manage exposure to PFAS. And so what I'd like to do is walk through several slides which will kind of set a foundation, a little level setting in the room. So I know that we're all on the same page when it comes to understanding a little bit of background on PFAS. And then we've put together some answers to questions that we're commonly receiving from physicians, from homeowners, from affected families, struggling through some of these questions about what do I do with the PFAS in my residential water source. So we'll walk through this presentation. I'm happy to answer any questions during the Q&A period, but I will say, if you have particular questions about health risks of someone in your family, specific questions about children or family members and PFAS exposure, I would encourage you to pull me aside after the meeting, follow up with me after the meeting, and we will answer your questions individually or connect you with environmental medicine or health experts that can address that question. But without any further ado, I'd like to jump into the presentation. So next slide, please. So many of you are aware that PFAS is not one compound, but many compounds, and they've been used for a number of years. They've been in widespread use since the 1950s, mostly coating any industrial or consumer product surface where we wanted to prevent sticking, like in the pans you use in your home, in the lining in popcorn containers, the lining in pizza board, that all contain PFAS at one point. They're resistant to water, grease, sticking. That's why we use them. They were also really good at suppressing fires, really hot burning fires, like fires from jet fuel, fires from military applications. You've all seen that foam that they spray, that's aqueous film forming foam that's used to suppress fires at really high levels. And that's where we see most of the contamination in the Commonwealth, in former or current military facilities where they've used AFFF foam in fighting fires. Next slide, please. So most of the time, communities, when we're talking to communities about PFAS contamination, it's because of a drinking water source. And mostly because the drinking water source is co-located near a source of PFAS exposure. Many times it's a Department of Defense facility or former localized environmental source. A lot of times it's from film forming or firefighting foam that's been used. But it's important to understand that we're all exposed to PFAS. I can almost guarantee if we were to collect a blood or urine sample from anybody in the Commonwealth, 99.9% of them would have measurable levels of PFAS in their body. Everybody is exposed to PFAS. We're exposed by eating food, using consumer products. It's in our environment, it's in carpeting, it's in ski wax, it is everywhere. So we're all exposed to PFAS. And that's an important consideration because I think prior to understanding that PFAS was in our environment, many of you would have thought we live in a PFAS-free world. We don't. PFAS are everywhere, and it's important to understand that. Next slide, please. PFOS and PFOA are two types of PFAS, two compounds. They're specific chemical compounds. They're one of many that are in PFAS. And it depends on the chemical test you use that tells you how many PFAS you can measure. Some tests can measure up to 40 different PFAS, 40 different PFAS compounds. PFOS and PFOA are the most frequently measured compounds, and they're the ones that we know the most about in terms of toxicological effects. They're the ones that there's been the most animal studies on to understand how those animals respond to those exposures. There's the ones where there's been the most clinical case studies or observations in humans exposed to PFAS, or large-scale studies of groups of people, epidemiological studies. The Department of Environmental Protection regulates 6 PFAS. I would say it's the 6 that we know the most about, the 6 that we can reliably regulate because there's enough information to form a basis to say something about what these levels mean. Next slide, please. So MassDEP measures these 6 PFAS, and they're shown on the screen here. What they do when they interpret exposure to these levels is they take the individual levels of all these compounds and they add it up. And they add them up and almost treat them like one compound, PFAS. That's why you see these different terms, different times, PFAS, PFOS, PFOA. DEP collectively regulates these as PFAS. That's a health protective or conservative assumption. It's meant to protect as many people as possible. And their goal is to ensure that your drinking water is below 20 parts per trillion. You'll also see that represented as 20 nanograms of PFAS per liter of water. It means the same thing. That's what a parts per trillion is. And a parts per trillion is also equivalent to a grain of sand in an Olympic-sized swimming pool. It is a very, 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 very small amount of a compound. MassDEP enforces this level in public drinking water systems. So if you're a public drinking water system and you're above 20 parts per trillion, they would take action to ensure that the public water system is below 20 parts per trillion. That's a lot different than saying that's a bright line. It's not like a COVID test. It's not like a strep test, positive or negative. Above this level, you're going to get sick, and below this level, you're not going to get sick. And we'll talk about that in the next several slides. But I want us all to have a little bit of level setting to understand really why we're all in this room together. Next slide, please. So how can PFAS affect my health? And I suspect that's many of your concerns, in addition to your concerns about ensuring that you have clean, fresh water at home, is how can this compound have effect on my health? And that depends on several factors. One, the amount of PFAS that you've specifically been exposed to. So the levels specifically in your home, how often and how long have you been exposed to that water? And many different personal factors. And personal factors can mean many different things. For example, the exposure to most people in this room, we're all ambulatory adults. Most of you walked in here, I think, and it looks like all adults in here. The exposure would be very different if you were a young child. And the exposure would be different if it was a neonate, a baby that might be nursing. So all of those considerations are what we're referring to as personal factors, the life stage of the person drinking the water. In humans, PFAS has been associated with increased cholesterol, decreased antibody response in children to various vaccines, changes in thyroid and other hormones, decreased fertility, risk of high blood pressure, also called preeclampsia in pregnant women, small decreases in birth weight, and increases in the risk of kidney and testicular cancer. As many of you might opine by looking at this list of symptoms, they're not specific to PFAS, and that's an important consideration as well. None of these is uniquely associated with PFAS exposure. So as you read through this list and you see, well, I have high cholesterol, perhaps it's related to the PFAS. I can't say if it is or it isn't, but high cholesterol is also more strongly associated with a lot of other things. And it's probably a combination of any number of things that leads to any of these health effects. Next slide, please. So can PFAS cause cancer? Cancer is a significant health outcome, and we manage that and regulate it a little different than other health effects. The US EPA draft evaluation recently concluded that PFOA, that's one of the PFAS, PFOA exposure can cause cancer in humans. They base that on, there are some studies in humans that show PFOA exposure at a sufficient level can lead to cancer in humans. And this is the opinion of the US EPA. US EPA also thinks that there's evidence that PFOS can cause cancer. That's less certainty in cancer. So one is they read PFOA, they think that can cause cancer. PFOS, it's suggestive. What makes it suggestive? Well, there usually means they see it in a rodent model. They might see it in a rat, they might see it in a mouse, but they don't see it in humans. Or the data in a rat and mouse might be different. So they say there's some uncertainty. So there's some uncertainty if PFOS can cause cancer. The risk of cancer too depends on a number of different factors. It definitely depends on how long somebody has been exposed to PFAS, plus their overall health status and that person's underlying genetics. So certain people have certain genes that either make them more susceptible to cancer or protect them from cancer. So like many chemical exposures, one of those things plus exposure to a sufficient amount of a chemical is usually what leads to cancer. We don't know exactly what those factors or exactly what that level is for PFAS, but this is the emerging science and where we're at with that. Next slide, please. So will I get sick if I drink water with PFAS above the MassDEP MCL, above that 20 parts per trillion level? Drinking water above the MCL does not necessarily mean you will get sick. Because you drank water above 20 parts per trillion is not the same as saying you are likely to develop any of those health effects. This is because the MCL, the basis for it, how we develop those levels, are sufficiently higher, much higher. The health effects happen at a much higher level of exposure. We make certain assumptions and set the MCL to be sufficiently lower so that any deviation over it does not necessarily mean that health effects are likely. The risk to a person's health, again, depends on several different factors, and a deviation from the MCL alone doesn't necessarily mean that you will experience any of the specific health effects. Next slide. So what should you do if you've been exposed to drinking water with PFAS above the MCL? And many of you are in receipt of laboratory testing results or have a reason to believe the water in your home is above that 20 parts per trillion level. Other than limiting your exposure, which is the most important thing everyone in this room should do, regardless of what your personal, whatever your lab results at your home say, the most successful intervention for dealing with PFAS exposure is look for opportunities to reduce harmful levels of exposure. Avoid PFAS when you're able to. So if someone tells you there's PFAS in their water, then avoid exposure to that PFAS water. That's the most important thing you can do. there is no medical intervention for PFAS exposure. So knowing you've been exposed to PFAS and bringing that information to your physician does not allow them to run any specific tests or manage you individually any different than if they didn't have that information. So that's the current recommendation from the Centers for Disease Control, is if you feel well, if you don't feel like you're experiencing, if you're having any symptoms of any sort of, or any health effects, then there's nothing additional you should do other than limit your exposure to PFAS. However, if you think you're experiencing any specific health effects, especially the ones that I've identified on this slide, and you've talked to your physician about that, in the source of which you really can't figure out why you might have a high cholesterol. For example, you've worked through some of the interventions your physician has spoken to you about managing your cholesterol, and none of that seems to be working. Then that's an opportunity to say to your clinician that you've been exposed to high levels of PFAS. And I will tell you, when you have that conversation with your PFAS, and informed by the survey that we just did, your physician's going to say, what's PFAS, right? Like, what can I do? And I'm joined today by a colleague, and I'll point her out to you if any of you have children, and this is a special concern. There are physicians in Massachusetts trained to answer that question for your physician. So a referral service, for example, a referral service of environmental medicine doctors that are trained to answer questions from your primary care clinician to address those kind of concerns. So if your pediatrician is managing a condition in your child that's associated with one of the health effects that we've described, and you want your physician to talk to somebody trained in environmental medicine that can answer some of those questions, we have resources available for you. If your own primary care clinician in adult care family practice doc is managing a condition that you think, well, PFAS exposure might be exacerbating or contributing to these health effects, then there's environmental medicine physicians here to help you. Now, that's different than saying there's any treatment for the PFAS exposure. There's not. There's not anything specifically about your PFAS exposure that would lead your physician to treat you any different, but your physician is the best person to talk about your own individual health. So if you have health concerns, if there's something wrong with you that you feel you need to talk with a physician about, I would encourage you to do that. If PFAS gets brought into the conversation because it's a concern at home and you know you're being exposed to that, and your physician doesn't understand what all that means, then we have resources to help your physician understand the health effects of PFAS, and that's an opportunity for all of you. We have some handouts. There's a clinic in Boston at Boston Children's Hospital called the Pediatric Environmental Health Specialty Unit, or PESU, and that's another facility that is supported by ATSDR, the federal toxicologist. And we're working with them to develop outreach for communities like this. And they have a clinic of medical experts. I'm not a physician. They have physicians and health educators there that can help you answer some of those questions. Next slide, please. So how do you know you have PFAS in your drinking water? PFAS are odorless and tasteless. Water testing is the only way to know if PFAS is in your water. The PFAS levels often differ depending on the type of water, the water chemistry. Is it a public water? Is it private water? That too, it contributes to your overall exposure, right? If you're not only drinking water from your home and you're drinking water at work, or you're drinking water somewhere else, maybe you have a second home, or maybe you're consuming water, you work in a hospital and you're spending 12-hour shifts there, then half of your daily exposure to water could potentially be somewhere else. And these are all considerations in terms of, is there PFAS in the water that I'm drinking in a given day? Next slide, please. If your water has elevated levels of PFAS, and this here slide, I understand there's POET systems being discussed and there's treatment for individual homes, but until there's a system installed in your home, if you know your water has PFAS, the best thing you can do is use bottled water. The Department of Public Health regulates bottled water that's sold in Massachusetts. Any bottled water sold in Massachusetts has to prove that by testing results from an independent testing laboratory, that water is PFAS free. That testing result is reviewed by our food protection program, and then a list of all legal bottled water providers in Massachusetts is available on our website. So if you're sourcing your water from the local grocery store, or you're sourcing it from a convenience store, and you want to know, is this water tested, you can go on our website and check. Mostly all of the brands, the large brands in Massachusetts, most of them are on there. For example, Poland Springs, I happen to know offhand, Poland Springs is a bottled water company that submits their test results and they're PFAS free. But there's even, store brands on there, and many stores carry 5 or 6 different labels of bottled water, and you can see that all on our website. An important consideration too, if you have infants and you're preparing baby formula for them, to also use bottled water for preparing the baby formula. Also, in terms of first foods for children, if you're starting kids on rice or oatmeal-based foods, or you're preparing some first foods, soft foods for kids, it's a good idea to use bottled water for that as well. Next slide, please. Additional ways to limit exposure, especially if you know that there's potential exposure in your bottled water, is to avoid cleaning products with this language in the ingredients. Avoid products with PTFE used in nonstick coatings. Certainly any new pans will say that right on the box. Any new pans will say that they don't contain that, so that'll be pretty clear. Any old pans that you're not sure of, that's something you might want to do a little research on and understand. A very important and very effective intervention is to use a damp cloth. Frequently clean mouthable and accessible surfaces in your home. Children can be exposed to a considerable amount of contamination by dust alone. In children, those of you with kids know that they tend to put a lot of non-food items in their mouth, including their hands. So any of their toys, any mouthable, accessible surfaces, window sills or things like that, to clean them frequently. A very successful intervention as well is removing your shoes before you go in the house. We all track potentially a lot of dust into the home, more so than you might even see on the floor. Kids playing on the floor, crawling on a rug can potentially be exposed to those levels. All of those things combined, if you implement those interventions in your home to reduce harmful levels of exposure to PFAS, can have a measurable effect in reducing exposure to young children. It is almost impossible to eliminate all exposures. Like I said, the Centers for Disease Control does a study each year, actually on 2-year cycles every other year, where they collect a representative sample of people in the United States, and they measure PFAS in their bodies. They virtually always find it in everybody. So it's out there. It's impossible to reduce all of our exposure. And I would say at this point, it's not worth even trying to reduce all your levels of exposure. What's worth pursuing when you know that your potential water source, there might be routes of exposure in your home where you know there's PFAS, is to look for opportunities to reduce your exposure to that PFAS and control it that way. Next slide, please. So can I shower or bathe? Important thing to consider, because PFAS is in your water, what we're most concerned about is ingesting PFAS, literally swallowing the water. The PFAS levels that we're aware of for most homes, this PFAS is not something that can easily go through your skin. One would have to incidentally ingest it, which means accidentally swallow the water to be exposed to an appreciable level. The best thing we can do with all young children, especially when giving them a bath or a shower, is to tell them you're playing a new game and who can keep their mouth shut the longest when they're in the bathtub, who can keep their mouth closed when they're in the shower. Really limit opportunities for children to ingest any of the water in the shower. That gives you, that will allow you to have the best sense that you're really limiting the exposure. how safe is it for a young child to shower? And up here, we've put together some guidance values. So a young child could take a 20-minute bath or shower at water that exceeded about 500 parts per trillion, and that would be perfectly safe. The child should also always, again, limit opportunities to ingest the water. So even if you have a child and I'm telling you it's safe to give them a 20-minute bath at water that's 500 or less, I would still look for opportunities to limit their exposure. Just make sure they're not swallowing the water, they're not accidentally swallowing the water. Older children, non-toddlers, around older than we think of young children like under 6, children between about 6 and I would say about 12. After 12, most children have bodies that act like adults in terms of exposure. So young children, other children, I would say around 1,300 parts per trillion, and then fully developed adults about 3,500 nanograms per liter. These are the recommended levels in terms of how long it would be safe for a certain person to bathe or shower at different levels. Keep in mind, PFAS are not readily absorbed through the skin. So the real risk in the bath or shower is ingesting the water. In other words, and I'm sure nobody wants to do this. I recently did this when I was renovating my bathroom, but you shower, if you were to shower with a 5-gallon bucket and a big sponge, right? There's potentially no risk of you ingesting water from washing yourself like you would if you went camping or something like that. So the water for a young child could be quite high if that was, if that's how you were bathing or showering. These numbers assume, they make certain assumptions based on scientific studies on how long certain aged children will ingest water in a bath or shower and how big their bodies are at those different ages. That's why there's different recommendations for different ages. But the recommendation for everybody is to reduce exposure by looking for opportunities not to ingest the water. So in other words, if you have a young child and you're bathing them with a sponge in a bucket, making sure they're not ingesting the water, or they're sitting in a sink and there's no way for them to ingest the water, then that's the best way to eliminate harmful levels of exposure. Next slide, please. So PFAS in pregnancy. If you're drinking water, if you have been told it's contaminated with PFAS, the recommendation is to limit harmful exposure to PFAS, immediately switch to bottled water, or use a certified filter or a bullet system and make sure you're drinking clean water. You should continue with your regular doctor's visits. Again, there's no additional information that the known exposure to PFAS would say to your physician that you should manage your pregnancy any different. You should continue to see your physician, continue to talk to them about your health status, go to your well visits. If there's a conversation with your physician about some symptoms or some health outcomes, and your physician wants to talk with an expert reproductive specialist in environmental medicine, we have reproductive specialists that can talk to an OBGYN about potential exposures during pregnancy. But there's nothing that you should do to manage your pregnancy any differently if you've been exposed to PFAS. Next slide. PFAS and breastfeeding. The most important thing that you can do if you're able to breastfeed is to continue to breastfeed. There's no recommendation for any adult exposed to PFAS that would suggest you should stop breastfeeding your children if you've been exposed to PFAS. CDC and the American Academy of Pediatrics support this and recommend that nursing mothers continue to breastfeed if you're able to do so. If you have any concerns about breastfeeding, you should talk to your clinician about it, talk to them about your exposure. If they're not familiar with PFAS, we're happy to connect your physician to an expert that can provide them some resources. Next slide, please. PFAS and vaccines. So we showed a slide a little bit earlier that there's scientific evidence and studies that PFAS limits the effectiveness of some vaccines. Let me be clear, we strongly recommend you continue with the vaccine schedule you have for your children, or if you're eligible for a COVID booster, you should absolutely take that booster, or take advantage of any vaccines that are recommended to you by your physician. The fact that you've been exposed to PFAS doesn't mean you should manage your health any different, including vaccines. Next slide, please. Cleaning with PFAS contaminated water. PFAS is not easily exposed to the skin, and it also won't hang out on the surfaces you're cleaning. So it's okay to use PFAS water to clean dishes. They don't pose a potential health risk. It's okay to clean your hands with water with PFAS in it, with soap and water, and wash them off, assuming you don't have any lacerations or cuts in your hands or abrasions, open skin. If you do, you want to take the normal precautions you would when washing your hands with a laceration, maybe cover that up. You should consider using bottled water for other activities where you think you might ingest some of the water, brushing teeth, cleaning dentures, cleaning baby bottles and nipples, pacifiers, or anything that your child might teeth or put in their mouth. Next slide, please. So PFAS and homegrown produce. So this is an area of intense research right now, trying to understand the relationship between environmental media like soil, even water, and the things growing in the soil or the things growing in the water. For example, what's the relationship between soil with PFAS in it and the produce that's grown in the soil? What's the relationship between the fish that swim in the water and the PFAS in the surface water? We don't have all the answers right now, and the data that we do have says that it's highly dependent upon many things. One of the things is the soil conditions. The other is the type of produce or the type of fish or the water chemistry. Water is incredibly dynamic. There's a lot of minerals or organic matter and things in the water that change it from site to site. So the science of how PFAS moves through the environment or food is changing rapidly, and it's really in the early stages. The current science suggests there's a clear dose-response relationship, meaning if there's high levels in the soil, there's higher than typical levels in the food. So it's likely that if there's PFAS concentrated in the soil, that there would be increase and corresponding increases in the produce. Next slide, please. Best practices for growing produce: use an alternative water source for seeding, use raised garden beds if you want to continue gardening, use commercially available non-biosolid compost or soils, and wash all fruits, vegetables, herbs in clean water. Peel root vegetables, take off the tops and bottoms. If you're eating a carrot or a beet or a tuber or something grown in the ground, cut off the top and the bottom, clean off the skins before you eat them. That's good guidance in general for eating any homegrown produce, or really any produce, period, is to manage your exposure that way. The other thing we always say is just like any strategy, the food pyramid and eating many different types of food. When sourcing your produce or eating even some of your homegrown food, mix in some other types of vegetables. Even I can tell you, even if you're always buying the exact same produce from the grocery store, you like always buying the Big Y brand or the Star Market brand, buy a different brand sometimes. Mix it in, because it will vary the source of where that food is grown. It will vary the chemicals in that food. It will vary the nutrients, and it will also manage your risk a little better. You spread your risk around, just like those of you with 401ks or things like that. You want a diverse portfolio. You want a diverse eating portfolio too, to really manage your exposure to contaminants in food. Next slide, please. So it's not possible to predict health effects based on exposure to PFAS in companion animals like pets or even livestock. Animals behave differently, they act differently, they have different biology. So animals are all different sizes than humans. Size is a huge determinant on PFAS exposure. They have different lifespans, as many of you know, and drink different amounts of water than humans. All these things make it very difficult to extrapolate a safe level in a human to a safe level in animals. So we don't know what the safe level for your dog is. We don't know what the safe level in livestock animals that you might intend to slaughter and eat. as indicated on that previous slide, in terms of growing produce, it's the same thing with growing livestock. We're just not sure. If you're concerned about the health or again symptoms of the animal, consult with your veterinarian. And that too, we have resources. If your veterinarian wants to speak to a veterinary toxicologist, we have resources available to help that. Next slide. So again, I'm the director and chief toxicologist at the health department. Our contact information is there. Our analysts will return your call and work through the questions with you, try to align you with an answer if we don't know the answer to that. And other resources are, there's the web link to access the list of bottled water in Massachusetts that I mentioned. And I will add here, and I'm sure you've all seen this, is MassDEP has a great website for PFAS in private wells, and I'd recommend you all take a look.
Thank you, Mark. I'm going to talk very shortly and then turn it over to Mark Baldy. I'm just going to talk about the site specifically, but I think it's clear from Mark Nascarella's presentation about why MassDEP regulates PFAS. The how we regulate started back in about 2016. The US EPA has rules about public water systems, which are systems that serve 25 or more people, and recommends every 5 years that people should, public water systems should look for certain unregulated chemicals. We don't regulate these things. We think they might be in the environment. You, public water systems, go and look for them. And that started in 2013. The initial rule came out. The sampling in Massachusetts started in about 2015. And as a result of that sampling, EPA came up with a federal health advisory of 70 parts per trillion for the two most common ones that Mark mentioned, PFAS and PFOA. It's not a regulation, it's a health advisory. But based on all the information that MassDEP and MassDPH gathered in that effort with these initial rounds of public water supply sampling, we started the process to issue our own regulations for PFAS in public drinking water supplies and private wells. We issued a cleanup standard in late 2019 and then an actual drinking water standard for public water supplies in 2020. The number's the same. It makes sense whether you're drinking from a public water supply or from a private well. It's the same water, and the standard is, as Mark said, 20 parts per trillion for the 6 PFAS combined. And we do sort of lump PFAS as all of these things. You'll see sometimes in DEP documents, PFAS 6. The PFAS 6 is shorthand for the 6 that we regulate. So up until this time, we did not regulate PFAS, and we are still one of only a few states that does regulate PFAS through a drinking water standard. There's not a national standard since that 2016 health advisory, but very recently, EPA has announced its intention to create in the very near future, maybe by the end of the year, a federal drinking water standard. There are no specific requirements for private wells. MassDEP doesn't regulate private wells, only public water systems. But what we do regulate is the cleanup of contamination in private wells, which is where the 20 parts per trillion in private well drinking water comes in. So under Chapter 21E, which is the law that covers waste site cleanup, it's very important to go through just a little bit of sort of jargony stuff to talk about what the law requires. Any location where hazardous materials were deposited, stored, placed, disposed of, or have otherwise come to be located is a site. When we say site, in our heads, we're always saying capital S, site. A site is a location where contamination has come to be located. The owners, operators, people who brought the hazardous materials to the site, people who arranged for it, people who transport it, are all responsible to clean up the site to a condition of no significant risk. And that's a term of art. The program is a semi-privatized program that requires people called responsible parties to hire a licensed site professional, LSP, to implement the cleanup subject to MassDEP's review. The program relies on these LSPs to come up with the cleanup. The government doesn't do the cleanup. The government supervises or oversees the activities, and the cleanup has to be done according to the regulations. And Mark Balding is going to go through the regulations. So the people I mentioned, the owners and operators, as well as anybody who brought stuff to the site or arranged for the hazardous material to go there, they are all responsible for the cleanup. This is important, without regard to fault. Because there's a site of any kind of contamination does not mean necessarily that something wrong happened. In this case, with PFAS contamination, and we're finding it in a lot of places in the central part of the state, our region is 77 cities and towns in the central part, and we have, I think, 27 communities, 54 separate public water systems that have PFAS in them. And that's not because people did things wrong. The public policy reason for MassDEP not having to prove that something is somebody's fault was that if the government has to prove what went wrong and who did what when, the site's never going to get cleaned up. So the idea of the legislature adopting Chapter 21E in this way with this strict liability without regard to fault is so that the sites get cleaned up. So even though there was no malfeasance, there was no midnight dumping, if you own it, if you operate it, if you brought your stuff there, you have to clean it up. That's the law. The liability is joint and several. And that means any one of those is responsible for the whole thing. And they're all responsible for the whole thing. They aren't liable to the Commonwealth, whether it's 1 or 15 of them. We can pick any one of them to pay, or 15 of them can get together, but they cannot establish that they are not liable to us. And there are nuances to all of this, but the fundamental principle is that the liability is strict, joint, and several. Sometimes the parties will get together and negotiate cost sharing agreements among themselves. Who's going to take the lead? Who's going to do that? That really has nothing to do with DEP, because the work just has to get done. If people are making arrangements behind the scenes, we don't really care who's paying the LSPs. The work has to get done. They also can't make agreements that change their liability to the Commonwealth. You can't make an agreement that says, okay, well, you're going to be responsible for 50% and I'm going to be responsible for 50%. That's up to you. You're each responsible to 100% to the Commonwealth. So the licensed site professional is an environmental scientist or engineer who has a lot of experience in cleaning up hazardous waste sites, not just PFAS, but all kinds, thousands, literally thousands of chemicals. They're licensed by the state in the same way people are licensed to accountants, attorneys, registered professional engineers. They're licensed by MassDEP, and they need to take continuing education courses and follow up on regulatory changes like PFAS to maintain their license. And we have a separate board of the LSP board that is responsible for disciplinary actions or referrals for LSPs who are not necessarily meeting the standards of practice that are set out in the regulations. So the fundamental idea, I think, is fairly simple. People who own it or brought it to a site are responsible 100% for cleaning it up. You know, there have been some concerns about the particular PRP here, the operator of the property, the owner of the property. It doesn't really matter, because I have a long list of other people who've brought stuff to the facility. And right now we have a group of 3 PRPs who are working on the site, who are pooling their resources to get the work done in accordance with the schedule that the regulations require. If for some reason there's a PRP who goes away, I know who the next one is, and I know who the next one is after that. So there are multiple PRPs, potentially responsible parties for this site, who are responsible for cleaning it up. The homeowners are not responsible, the taxpayers are not responsible, the Commonwealth is not responsible for cleaning it up. The potentially responsible parties are footing the bill for whatever the ultimate remedy turns out to be. So Mark is going to talk in more detail about how the regulations themselves work, but I just wanted to make sure that people understood the framework for how this is all happening.
Thank you, Mary Jude. So as Mary Jude said, Chapter 21E is the law. That's the statute that outlines our authority as DEP, identifies liability, and directs us to establish regulations for the cleanup process. The Massachusetts Contingency Plan for CMR 40 are those regulations that outline how disposal sites are cleaned up. I'm going to go through very quickly here 1,600 pages of the Massachusetts Contingency Plan in one slide. So it starts with notification to the DEP of a release. It's come in from private parties. Whenever we have a release of spill, there are different triggers for notification. Contamination in a private well is one of those triggers. Contamination in a private well also requires an immediate response action. An immediate response action is exactly what it says. It's something that you have to do right then to take control of a release of spill or controlling the exposure to that release of spill. A year later, the potentially responsible parties have to submit a phase 1 initial site investigation report. That report identifies sources at the location. It has to include installing groundwater monitoring wells, and it scores the relative seriousness of the site. After that, the potentially responsible parties have 3 years to complete the phase 2 comprehensive site assessment. This includes identifying all the sources on the site, the nature of the contamination, what type of contamination it is, what environmental media is in soil, groundwater, indoor air, where it has come to be located, the extent of the contamination, and finally, the risk to human health, safety, public welfare, and the environment. Then a year later, the potentially responsible parties submit a phase 3 remedial action plan. This is a feasibility evaluation where they look at all the technologies. Now that they know what the site is comprised of, what kind of contamination, what the risks are, they look at all the different technology, cleanup technologies, and based on a technical feasibility and a cost-benefit analysis, they select cleanup technology for their site. At the same time, they're submitting the phase 4 remedial implementation plan. That is, okay, now we've picked the technology for this site, and this is how we're going to apply it specifically at this location. They then have another year to implement that remedy and ultimately reach either a permanent solution as a closure or go on to a long-term cleanup. As it says there, the IRA goal is to control the drinking water exposure to PFAS. The long-term goal is to achieve the drinking water standard of 20 nanograms per liter PFAS in the groundwater. Most sites actually close within a year. Complex sites have up to 6 years to close or implement the long-term cleanup. And make no mistake, this is a complex site. But if the PRPs choose, they can go faster than the 6 years. They can reach a closure at any point in the process as long as they meet the standards of that closure. So they don't need to take the full 6 years. And when it comes to the feasibility piece for eliminating exposures, they may decide that choosing one remedy over another is more feasible up front than waiting, till year 4 or 5. The LSP performs a site assessment and selects the cleanup remedy. And then MassDEP, as Mary Jude mentioned, we oversee the immediate response actions, we approve them. And then we always have the ability to come back and audit the work that we don't approve. So contamination detected in a private well triggers notification and an immediate response action. IRAs must eliminate, prevent, or mitigate exposure to contamination in a residential private drinking water well. And mitigation alternatives include bottled water, which we think is pretty much feasible everywhere. Well treatment, like point of entry treatment systems for homes. And if available, connection of public water. If you have a water line that's running by your house in the street, you have a private well that's contaminated, it's very feasible to connect to that public water line. So in the case of Mass Natural Fertilizer, MassDEP was notified on February 18th of 1,335 nanograms of PFAS detected in a residential well on Bean Forest Hill Road. We immediately provided bottled water, retested the private well, and sampled 6 private wells within 500 feet of that home that had notified us. That's our standard procedure. We generally start from a position and work our way out. When we got our lab results back from those homes that we sampled, they range from 333 nanograms per liter to 1,815 nanograms per liter. And we verbally notified Mass Natural Fertilizer when we got those results on March 15th to let them know that they were a PRP. They had a release in private wells that had to be addressed as immediate response action, and they had to hire an LSP. We then issued notice of responsibilities to Mass Natural Fertilizer as the operator of the site, and Otter Farm as the owner of the site on March 31st, requiring, again, further private well testing going out 500 feet, providing bottled water and treatment systems. Mass Natural hired Larry Lassard as its licensed site professional, and Otter Farm has hired LSP Jeffrey Arps as its licensed site professional. As soon as sampling started under LSP Lassard, he discussed with MassDEP the 500-foot radius, and we quickly came to the conclusion that that wasn't a big enough radius. And he agreed to add all of White Pine Drive, Rock Maple Lane, and Amber Road to the sampling area right off the bat. Since that time, based on the results that they've gotten back, and results that they've gotten back from all of you who have sampled your wells in private, the sampling area has expanded. Now it includes all of Sawyer Road, Timax Road, Woodland Drive, Oakwood Court, and as recently as yesterday, when I spoke with LSP Lassard, we expanded South Ashburnham Road from 37, which is at the southeast end of South Ashburnham Road, where the water line ends, to 147, which is approximately 500 to 700 feet west of the intersection with Bean Forest Hill Road. Meanwhile, Bean Forest Hill Road, the area has expanded from the intersection with South Ashburnham Road all the way up to 255 Bean Forest Hill Road. All of these areas can get bottled water from the PRP if you contact Larry Lassard. You get that before they test. As soon as upon first contact, they will provide bottled water to you. And you can contact Larry Lassard at Westminster at lassard-environmental.com. So some of these numbers have changed just since yesterday when I spoke with LSP Lassard. As of June 2nd, 83 private wells have been sampled, but there are 197 private residential wells that he has requested access to. He's received 110 access agreements back. And they've detected concentrations of PFAS ranging from 3.69 nanograms per liter to 5,736.9 nanograms per liter. That is in the well at Mass Natural Fertilizer itself. Again, bottled water is being provided to all the addresses in the expanded sampling area. If you live in that expanded sampling area, contact LSP Lassard and you can get bottled water. As of today, 29 point of entry treatment systems have been installed. They have 9 that they're working on right now to get installed, and have 110 POETs that they're working vigorously to get delivered as soon as possible. And at MassDEP's request, the LSPs from Mass Natural Fertilizer and Otter Farms are cooperating to work together and pool their resources to get this done. You know, they're working on the logistics of sampling, bottled water, and point of entry treatment systems. This is a map of the sampling area. The gray plots are all within that expanded sampling area. The purple plots are those that have concentrations of PFAS-6 exceeding 90 nanograms per liter, which is our short-term imminent hazard level, which means that there is an increased risk over the short term for health effects. But as Dr. Nasrallah said, it does not mean you will necessarily experience those effects. The red plots are places where we have between 20 and 90 nanograms per liter, and then the yellow ones are below 20 parts per trillion, and then the green plots are no detections. We have a paper copy of this map over there up there at the back of the hall. So if you'd like to take a look at that and see where you are in relation to it, it's there for everybody to take a look at. And on April 12th, Deborah Hooper had arranged for a petition from residents to be provided to Mass Natural Fertilizer and Otter Farm for public involvement at activities. This allows, it's formal notice that the community would like to be included in the information that's being generated. It allows people to comment on those submittals that the licensed type professional is making and give feedback. Doesn't necessarily mean they're going to agree with the comments, but they have to respond, and they're all on the record. The written IRA plan was submitted to MassDEP for approval on May 16th. The public comments were due by June 5th. I think they may still be taking comments. I spoke to Mr. Lassard. He said they hadn't started working on their responses yet. So they may still be taking comments. DEP has no deadlines. We will take your comments anytime. Under some of the public involvement activities that the PRPs have implemented are conducting remote meetings via Zoom. And I would suggest maybe talking to Deb Hooper about how to join the public involvement group if you're not on it, so that you can get invited to those Zoom meetings. And they've also developed a web-based survey to gather information on sensitive receptors at each house. And this will be helpful information for them to be able to prioritize the deployment of treatment systems for homes. And the LSP is also responsible. They're providing us with weekly updates on the immediate response action. Let's go to us. We go to the Westminster Board of Health, and to the residents. They're generated every week. They tell who's been sampled, what those results are, what they're planning for the next week, how many poets they intend to install and such. Those are all available on our website. If you go through the DEP website, there's a button on it that says search for contaminated property or look up contaminated property. That'll take you to the web portal, and you can put in the town, the site address, the release tracking number. The release tracking number that was assigned to the site with the issuance of the NOR is 2-0021866. And for our immediate next steps, we will be approving the IRA immediate response action plan with conditions, hopefully this week, that will require continued private well sampling, providing boiled water, and installing treatment systems. Our focus is on identifying those drinking water exposures and mitigating them. That's critical. Clean drinking water is a necessity. It's not a luxury. And that's our primary focus at this point, is making sure that we find out where the contamination is and getting relief to the homeowners to make sure that they are addressed properly. The IRA will also contain requirements to address surface water contamination and groundwater contamination sources at the site itself. We do have some surface water samples that show a stream that originates on the property does have PFAS contamination, so they will have to address that. And as I said before, they're gonna have to put in monitoring wells. They're gonna have to find the sources and address those. And based upon the data we get back, the study area may continue to expand. We will continue to chase it until we reach non-detects. Thank you, and these are our contacts.
Okay, thank you so much. Thank you, especially to Mary Jude and Mark Nescarella and Mark Baldy for your presentations. We are going to open the Q&A portion of the meeting at this time. So the Q&A portion of the meeting is targeted to residents of the greater Bean Portage area to answer specific questions related to the site investigation. There are 2 microphones at the end of each aisle. Please line up at either microphone, and before you ask your question, if you would tell us your name and your address. We'd like to limit questions to 1 question per person, at least to start, so that we can give everyone a chance at the microphone. And I'll also be asking questions on behalf of the webinar attendees. So same request to webinar attendees, please submit your question along with your name and address in the question and answer box.
Good evening, I'm Christopher Cervasolo. I'm at 130 Bean Portage Hill Road, Mary Jane. I've sent you some copy to the legal department as well as Mr. Lassard. I'm a kidney cancer survivor, and according to Mr. Lassard, he said that this issue of mine was going to be examined. I'm in the red area. I'm still awaiting a response from Mr. Lassard on that comment. Can you please provide any information based upon priority? I know that there are other residents here that are far higher levels than I do. However, I'd rather not lose another body part. Thank you.
So, Mr. Sarasolo, I have spoken to Larry Lassard, not particularly about your case, but in general about where he does have information on people's health concerns and health histories, prioritize those along those concentrations that are highest, and also homes that have children. So hopefully those are the criteria that he is using to be able to schedule getting them poured into your system on the shorter end rather than the longer.
Okay, thank you. That's perfectly fine. However, it'd be really nice if you could please tell Mr. Lassard that email works both ways. If you ever reply, tell me this as well. It just seems like my emails to them have all been one way. I understand they're busy, I understand they're overwhelmed, but the communication needs to flow both ways. Thank you.
I agree.
Hi, I'm Debbie Wise and I live at 153 College. So I'm one of the new add-ons. I did call Larry and he did call me back. I didn't do the email. I just kind of harassed the secretary a little bit, I guess, because I wasn't getting answers. He said I could just sign the paper and mail it back to him, but I just have the address for the attorneys. I don't have the address for Larry Lassard. Do you have that? Could you get that for me? So I could-
Yes, certainly we can. I don't have it on me at the moment, but if you want to speak with us afterwards, I'd be glad to get your information and get Larry's address.
Yeah, because I was trying to find out if they were licensed and the labs they send it to was certified. I was just trying to get those basic questions and I wasn't getting any answers, but he
So I-
finally called me back, so.
I think from having spoken with people in this room about these access agreements, I think the intention is for you to return it to the attorney who sent it to you, not to Mr. Lassard. So the return address for Lawson and Whiteson is where it should go. I can tell you, and we know from speaking to the LSP, they are using all the appropriate labs, all the appropriate methods, and that's absolutely taking place. For the access agreements, they have chosen to have a law firm handle that, and you should return that document to Lawson and Whiteson. If you don't,
Okay, I
if you
can
don't
do
have,
that.
it, if you have that address, if you don't, I can look it up for you.
No, I have the address,
Yeah,
but when
that's-
when I talked to Larry yesterday, he said that I could just send it to him, so that's why I was asking for his address, but I'll do it to the law firm. 'Cause I just got all this information the last week and a half.
Ed O'Brien, I'm on 20 Woodland Drive. So I'm sure you looked at Mass Natural's website. They tout themselves as a pioneer with DEP and quote unquote the guinea pig of certain supervisory and monitoring scenarios. So, Mark, your presentation is fantastic. Thank you very much. One of the things you said was length of exposure is a critical issue. If the DEP has been monitoring this site since '86, how long has it been contaminated? Not how long has CDC recognized PFAS as a contaminant? How long has the contamination been going on?
There's no way for us to know that. No one was sampling for PFAS in 1987 or in 1989 or 2019. Sampling didn't
But
start.
the sources haven't changed, correct?
And I believe the sources have changed over time since the last 35 years. Their feedstock has changed.
Well, leachate contamination is not a new thing, right? Leachate containment is not a new thing. I've been responsible for hundreds of DEP sites. And it's kind of hard to believe that a relationship that goes back to '86, unless it's being misrepresented by the site, the website. We're finding out about this, in June of 2022, number one. And number two, that it had to be found by a private individual.
We have no control over what they have on their website. We did ask their attorney to change some of the language that I believe was misleading. It seemed to read that we licensed everything that they did, which is not true. We license what they can bring into compost.
Okay.
It's always licensed, and my understanding from our attorney was that they did fix some of the language, but if they want to represent themselves in a certain way, that's fine, as long as it's not
Well,
And
we're
it's not
depending
that there
on
was
you.
ever a
We're
partnership.
now depending on you to guide us out of this. And I'm trying to understand, A, how long the contamination, since you monitored the site since '86, according to the website. If you've got different information, I'm sure we'd all like to hear it. But right now, we're depending on you to guide us through this.
Which is what we've just talked about doing.
It was a great presentation.
I do have a few questions on behalf of the Zoom residents. For Department of Public Health, can you talk a little bit about what is the high level in blood tests and when should people worry? Also, how long does it take to lower the levels of PFAS in your blood? For example, the half-life once you're exposed.
Excuse me, thanks, Andrea. Thanks, Mr. O'Brien. It's a great question. So, you know, the PFAS is a compound, it's a group of compounds, and some of the individual PFAS analytes, scientists are able to measure in blood. And these scientists, these laboratories that can do it are not your average laboratory. They are specialized laboratories. There's many of them throughout the country, but if you go to your primary care clinician and ask them to measure PFAS in your body, they're likely not going to know what you're talking about. That said, there's labs that will take your business and they will measure PFAS in your body. And what's sometimes done with those levels is they compare them to the studies I referenced that CDC conducts, the studies of all of the United States, right? Where they're measuring people across the country. And oftentimes we will compare those biomonitoring levels. That's what we call this when we test human blood or serum or urine, we call it biomonitoring. We compare these biomonitoring levels to national reference levels taken from people all over the country. Every state is a representative sample. I can guarantee you, having conducted biomonitoring studies of my own in Massachusetts, if you test the blood or urine of people that are exposed to a chemical, you will find it. There is no need, there is no reason to think that people drinking PFAS in water will not have PFAS in their blood or serum. We know that, right? It's kind of a first principle. I think we can all agree the exposure might be there. Here's the difficult thing. We don't know the level. We don't know what to do with that test when we get the result back. We can compare it to a representative sample of someone that has provided blood in the United States, and we would see that it's higher than the average person. But I can tell you that's probably already the case with people that have been drinking water with PFAS. Your level will be higher than the average person sampled in Nebraska or Idaho or Florida or something like that. But there's nothing your physician can do with that information. There's not a safe level of PFAS in your blood. There's very few chemicals for which we actually have those sorts of things. There's probably less than a handful of levels that have actionable clinical information about measuring a chemical in your body that we would recommend doing something. The exception is lead. We measure lead in children's blood. Every child in Massachusetts between the ages of 0 and 5 has their blood lead measured at least twice. There is very clear evidence on what you do with that information. If there's lead in a child's blood, we know that at certain levels that go to the home, we want to identify the source and reduce it. With PFAS, if you've been exposed to PFAS, the best thing you can do is look for opportunities to reduce harmful levels of exposure. And a blood test is not going to tell you that. A blood test can't tell you the source. It can't tell you where the PFAS is coming from. If I measure PFAS in your body, I can't pinpoint if it's from the water. I can't pinpoint if it's from the ski wax you might use, from the carpeting in your office building. It's very difficult to say where it's coming from. So for me, that's very confusing information to give to somebody because you're not going to be able to use it in a diagnostic way to treat any health condition. Your physician will tell you that. And I won't be able to give you any advice on how to reduce your exposure in the home. For those reasons, we recommend individuals not conduct individual biomonitoring. Biomonitoring is a very effective and powerful tool when it's used as part of surveillance, when we surveil populations like CDC does, because then we find people with high levels of PFAS. And you know what we do? We bring the environmental regulator in and try to find where it's coming from. We're already at that point. You have a fully engaged environmental regulator that is working with a potentially responsible party to mitigate sources of exposure. And that's how we use biomonitoring results. You already have that result. We don't use it like a strep test. We don't use it like other blood tests to say, we now have this result, let's treat X or Y. We don't use it like a lead test to say there's lead in your child, let's find the lead painted surface and eliminate it. We don't use it that way.
And one additional question for you would be, can you talk a little bit about Crocker Pond? Why is it closed, if it's safe to swim, and also if there will be any fishing advisories?
Sure, great questions. So my understanding, and I'll say that Crocker Pond is a local swimming resource, as you all know. It's managed by a local community. So they are the ones that decide when Crocker Pond opens or closes. It's not a state operated water body. So I will share my opinion on why it's closed, but I'll certainly defer to the local expertise. My recommendation to the community would be to not open that water body until you have a sample of water from that water body that identifies it, what the PFAS levels are. And I think that's the decision the local community made. And I would support that, but I would say out of deference to them, that's their decision. Once a water sample is taken from the beach where people would swim, we are able to interpret that level. We just did a study last summer. We sampled a bunch of water bodies around Cape Cod, near Joint Base Cape Cod, a known location of water contamination. And we interpreted the water, we interpreted if it was safe to swim or not based on some laboratory testing results. My understanding is that's what the community offered to do, working with DEP, collect a water sample and have that water sample interpreted before they open the beach. And I think that's a safe and health protective way to manage that water body. I will say there's other things that go into opening a beach. Just so you're all aware, the water body needs to be tested for enteric bacteria, the things that make you really sick in a water body when you're swimming. So that's another factor. Once the PFAS is ruled in or out, that water body will need to be tested for bacteria before it can be open. And that's in Department of Public Health regulations. So that's something else the health department has to weigh, is find out if there's PFAS there. If there's no PFAS, then they'll have to test the water body. For the normal things, we require all water bodies to be tested before we allow people to swim in them.
Go ahead.
Yeah, Scott Lagoon from 11 Amber Road. And I'm just on back to what Ed was saying about the website. I'm just kind of curious, did the MassDEP help Mass Naturals set up their process in which they were recycling and composting, like the website says?
We were not partners with them, and that was part of the thing that we found.
It's a little misleading. I mean, to like
It is.
be reading that stuff online.
I understand, and we're here to answer questions, and I could answer that question.
They also stated too that it was regulated by the MassDEP. Is that allowed to?
That it's regulated?
By the MassDEP. So
It is regulated by us. So in 1987, we got started two permits. One from the Westminster Board of Health, which is called a site assignment, and then from a permit from DEP. And under the solid waste statute, none of this stuff, this is all Doug Klein's job. You have to, if you're going to have someplace that manages solid waste, the local community has to first of all get a site assignment, or else DEP can't even issue a permit. 1987, Westminster Board of Health issued a site assignment, DEP issued a permit for certain kinds of waste to be brought in for composting. That permit, that site assignment have remained in effect the entire time. We changed our regulations in 2014 to encourage recycling, especially organic materials like food waste, to have an exemption from site assignment for composting with food waste. So when those regulations went into effect, we started the transition of some of these older facilities into the new permit program. We have a permit that was issued in 2020 for the composting that remains in effect today, but it's a constant regulated line from 1987 to today.
So, I mean, was PFAS started showing up in 2013? I'm just kind of wondering, was any of that tested back in 2013? I mean, it's 10 years later, just.
2013 was when EPA asked public water systems to start looking for it. We started here in Massachusetts looking at public water systems in 2016. As I said before, there are no standards for regulating private wells. We don't issue regulations for private wells to be tested. There is nothing in Mass Natural's permit that we issued in 2020 that says that they have to sample for PFAS, because again, in 2020, no one was sampling for PFAS. There is language in it that says you have to sample for all these things and anything else we ask you to sample for, including emerging contaminants, which is why Doug and his group were out on the site last week coming up with a protocol for all of the things that we want them to test that's happening now.
Thank you.
My name is Bridget Crane. I live at
Could you
22
speak into the microphone? So, thank you.
Hello, my name is Bridget Crane. I'm at 22 Woodland Drive. I see a lot of my neighbors are here and we're all very concerned. You just gave a presentation on the PFAS, and in it you said that for adults it's 3,500 ng/L. But the standard that you gave us was 70 ppt. So how do you convert that into PTT to understand whether or not it's safe to shower? I mean, currently Crocker Pond is closed for bathing, but you're telling us it's safe to shower. My well just got tested yesterday, and my neighbors have gotten, some of them are getting water filtration systems put in now. I don't understand why there was such a delay. If there was supposed to be weekly communication with residents. I only received a letter 2 weeks ago. The lady over here said she just received a letter. Some of our neighbors got immediate responses, some of us didn't. So I'm really concerned about the coordination of communication with the immediate response plan. I'm also concerned about the use of these different measures for pollutions. For example, the shower measurement, I have no idea how it coincides with the standards. You know, yes, after asking for 2 weeks for portable water and being told by the attorney that first I had to sign an agreement before I got portable water, which wasn't true. So I'm really concerned if we're going to be having a 6-year relationship with all of you, because this is a complex cleanup project. How communication is going to be to us all, not just on websites. We need to have notices in newspapers. We need to have it on local community channels. The agreement sent to us by the lawyer said that we had to sign a confidentiality clause, that we could not retain other attorneys in this event. You know, so there are some things that I find are egregious about what's going on in this process. Some things I admire, but you know, we really need and count on you to keep things fair and to keep the guidance coming and to provide clear guidance. The use of these acronyms in the presentations, all of us are trying to absorb who is an immediate, what's an immediate response plan. You shouldn't be using any acronyms in the presentations. You should bother to spell things out so we can absorb it and understand it. This is going to be a process for all of us. This is my feedback. I would like you guys to consider changing your presentation so it's all in accordance to the PPTs, providing us the weekly input that we need, not just based on obscure tracking numbers, and work with us, because we all want to have a healthy community. A lot of us have been part of this town, myself, 27 years, and this is egregious. So thank you.
Well, thanks for the feedback, really. I think This, we view, I think, all the content we put out as something that we're constantly revisiting and trying to do it better. I can say after going to a lot of public meetings related to PFAS, if you've been to one public meeting, you've been to one public meeting. Every community is different. Every community has different concerns. And the concerns here in Westminster are somewhat unique. There's high levels in people's water, in levels that are potentially, they're certainly not safe to drink, but they're also unsafe to potentially bathe in for an extended period of time. And this is something that we're developing guidance for you, developing it rapidly. I have teams of scientists that have spent their careers studying toxicology. It's tough to find those people that fill state roles, trust me. So I have them working on these questions nonstop to try to develop guidance, and we try to push it out as quickly as possible because I'm worried about the families at home with young children that are trying to keep them clean, trying to bathe, trying to not pour bottles of water over their kids, or have grandparents worried that they're poisoning their children in their homes. So we try to push out the guidance, and from what I hear from you, we got it wrong the first time. So we can do that a little better. Let me explain it to you in maybe a different way. So there's a safe level of PFAS that a scientist can tell you that's safe to drink. When a scientist says that, we make certain assumptions about how much water people drink. I can say to a degree of certainty, most adults in this room drink around 2 liters of water a day. And some of you are saying, I drink way more than that. I'm a runner, I drink 3 liters a day. And some of you are saying, I don't drink any water, I drink about an 8-ounce glass. But across the room, you drink about 2 liters of water a day. And so we develop a standard knowing what the unsafe level of PFAS is in the water and try to prevent anybody from drinking more than that amount in a given day, knowing that most of you drink 2 liters of water a day. So DEP has developed that level, and I'll tell you, it's 20 parts per trillion. PPT, 20 parts per trillion. Another way a scientist says that to confuse you, it's job security for us scientists. We like to say things a different way. We also call it nanograms per liter. It's another way of representing that. PPT and NG-L mean the exact same thing. So 20 PPT and 20 NG-L are the same thing. That's the safe level of PFAS that you can drink in a given day. EPA has put out a level that's 70 PPT as a guideline a number of years ago. And that's what Mary Jude mentioned. That's where the 70 comes from. That's the federal guidance for 2 of the PFAS compounds, PFOS and PFOA. I would submit to you, forget about that. It's important context, it's important history. It means nothing in Massachusetts. We regulate to 20 parts per trillion. So going back to that, the 20 PPT, that's the safe level you can drink of in 2 liters a day. When you shower, I bet most of you, I know you don't drink 2 liters of water a day in the shower. You ingest just a little bit you might get in your mouth. A child might get more in their mouth. A toddler drinks more water in the bath than you do as an adult, and much less as an infant, right? Because an infant, you're holding in the water, you're watching closely. You put a 6-year-old in a bath, you put him in the bath and walk away maybe. So let me know when you're done. They might be drinking more water. Scientists know that for each age range, we know about how much people sip when they swim, when they bathe, when they shower. That's why we have these different levels. It's not because we're not sure of what the safe level is. We know. We're just not sure of how much water a child drinks in the shower, or the bath. And we develop these guidelines to say, if you spend about 20 minutes showering or bathing, your water can be up to this level and it's still safe because you will only ingest this small amount and it could be up to this level. So for a kid, we know if the water is up to 500, even 500 parts per trillion or NG/L, we know you can put the kid in the bathtub and walk away and they'll be safe. Because we know that kid's typically only going to drink a little water. If you know your kid gulps the water, don't let him bathe. If you know you have a child with pica behavior or pica behavior, if your physician has ever told you that, they put a lot of things in their mouth and they might drink a lot of non-nutritive stuff, keep them away from the water. But we're putting them out recommendations that allow you to potentially bathe or shower. And it's the same thing when swimming in a surface water body. We know the level at which you might incidentally ingest water while playing in the water or swimming. But I'll tell you that most water sources, if they have high levels of PFAS and you're just walking into the water, how I like to swim, I just might walk into a surface water body, cool off a little bit, and then walk out. If you're not ingesting any water, no exposure, no risk. But we are making these different recommendations with assumptions that when you swim, when children swim, we know they drink small amounts, and that's why the levels are different. So we're not trying to play any funny math, we're trying to communicate that, but we'll try differently and communicate it a little differently.
All right, I'm just going to speak to your questions about communications, which is something that we've heard early and often. Mark Baldy and I came to a Board of Health meeting in Westminster on April 8th, just as everything was gearing up to make sure the Board of Health understood what was going on, the roles and responsibilities of LSP, the level of CEP oversight, given that this is an immediate response action, all of the site planning and developing a remedy, we were going to have to wait until we identified the extent of all of the exposure and had that exposure mitigated. After that, after our part of that meeting was done, we went out in the hallway with several residents and heard concerns about the access agreements, about the lack of communication. The regulations have this process for a public involvement plan that typically kicks in way further down the line after the site has been fully described and the extent of the contamination is where to be. We suggested that this site should be a public involvement plan site right now. There should be a group that is getting information every week. We asked them to have Zoom meetings that they're having once it became clear that just sending the information out wasn't helpful. We will continue to speak with them about ways to improve that communication because we do, team here in the front row hears directly from a lot of people about the communication still does not work. We were pleased that a second LSP has been brought on by one of the other potentially responsible parties. That second licensed site professional is providing additional professional support in terms of bouncing ideas off of, coming up with how to expand the study area. Also in going to separate vendors to purchase the public systems. So now they are going to 2 different places to buy them instead of just one place. We have multiple plumbers hired now. So instead of everything happening through one channel, we've expanded the ability to get more treatment systems from more places and to have more people available to install them in homes. So we are going to continue to work with them on the communications. I honestly do not understand why it was so difficult for them to communicate. You're here, you came to this meeting tonight, or I don't know how many people on the Zoom. Clearly, people want the information and we need to work harder to make sure they get it to you in a timely way and in a way that's useful for you to see. We pledge to do that.
I do have a couple questions from the Zoom group, and there are 85 on the Zoom tonight. Can you talk, Mary Jude, briefly, because I know we're already over our time, we're very, very close. What is going on at Mass Natural now? Are they still accepting product? Are they also any sold material? Is that being tracked at all? What kind of monitoring is taking place at the site?
If I should put Doug on the spot, I'll talk in general and Doug can jump in if I say something wrong or I don't have the most up-to-date information. So the operation of Mass Natural takes in, for lack of a better term, raw materials. It's in paper fiber, food waste, other kinds of waste material, composts it in a couple of different ways and makes different products that you can see on their website. They make topsoil, they make screened compost, unscreened compost, potting soil, and a couple of other things. Without consulting DEP, they took samples of 2 stockpiles on the property, provided the information. I'm sure everybody has seen the weekly report. It was in the weekly report number 3 or number 4. Showed levels of PFAS exceeding soil standards, which are different from drinking water standards. There are soil standards and they're per compound, not an aggregate of 6. The soil samples they took that we didn't know where they came from showed exceedances of PFAS in the soils. Because we didn't know where they came from, because we knew that they were selling products, we issued an order on some date. Doug will find out. We issued a unilateral administrative order directing them not to sell any of the product that they had tested from the materials that had PFAS in them. You came to us, you told us you have PFAS, we have no idea how you did your test, we don't know where you tested, we don't know what you tested, but you tested something and it has PFAS and you can't sell it. So we issued that order and they stopped. They are still selling mulch, I believe was the one thing that they're selling. We did a site inspection last week with everybody up in the front row went, and then the solid waste program staff who worked for Doug to exactly see what these piles were, what the incoming, what the intermediate, what the outgoing, what they mean when they call things different things, and we've asked them to develop a sampling plan so we can get samples of everything with an understanding of what it is they're sampling and where it is, what they're talking about. We have just provided them with comments on that sampling plan, and they'll be implementing that, I would assume, in the next week. Once we get the revisions back from the comments that we just gave them. We'll be getting a lot more information. We'll be getting information in the way we want the information, which is not what we got, but we were presented with something that concerned us, that there was PFAS on something that was being sold, and that had to stop. So it happened.
And the order was issued May 17th.
Could I just add, actually, it's okay. Chris Sarasolo, 130 Beanport Hill Road. I'm actually one of the administrators of the social media group that we have here. And because the communication has been so horrendous with Lassard, in fact, I'm a consultant myself. If I treated my clients that way, I'd be bankrupt right now. There's a breach of trust there, or some skepticism, I should say, regarding the testing, the variation between what some of the residents are doing on their own privately versus what Lassard's testing. And Mary Jude, when I copied you on this message here, I just wanted to ask your opinion on that, because I want to try to just squelch the idea that there's a conspiracy going on here. When I asked why there was such a discrepancy with mine, it came back at 49.7 parts per trillion, and Larry said his came back at 33. And his comment to me was there can be sources of variation based on groundwater flow, passage of time, accuracy, and precision of laboratory testing equipment and other factors. Again, I understand as an engineer, there's entropy in testing equipment, but a lot of the testing that's been coming back from Lassard has been considerably lower. In my case, what, 30% lower than what the private company I had tested. Could you comment on that? Do you agree with Mr. Lassard's comments there that those variations are normal and can be expected?
Variations can definitely be expected, and it depends. First of all, parts per trillion nanograms per liter are extremely small. Mark's example of, what was it? One drop in an Olympic-sized swimming pool.
Grain of sand in Olympic-sized swimming.
Yeah, so when you're talking about parts per trillion, a deviation of even 5 or 10 parts per trillion is not something that we would consider statistically significant. In the public water system sampling, systems are sampling now, a lot of them are sampling monthly, so we're seeing month over month over month, and those results do vary. They're not necessarily within 5 or 10 parts per trillion of each other, and again, groundwater is seasonal, it goes up, it comes down. There are reasons that that would be. I don't know what his conversation with you was, so I'm not going to have any opinion about what he said, but I can tell you that that kind of deviation is something that we've seen in the drinking water program, and we have actually seen variations among the laboratories. There have been public water systems who are seeing sort of the same thing. Why am I getting a number from this lab, and why am I getting a number from that lab? And we're seeing some deviations between the different labs, and they're running the method the right way. It's an EPA method. It's very strict the way you run it, and yet with these extremely small measurements, there are deviations. So I don't think there's a conspiracy there. So you've been waiting so patiently.
Thank you.
Hi, I'm Patty Sylvia, I'm at 164 South Ash. And where I'm located, I'm not marked on your map, but it's peppered all around me. So I'm concerned because my property is right on Crocker Pond and we weren't even notified. So we have a beach right on Crocker Pond, we can go swimming, we have boating, and nobody let us know. We found out word of mouth. And then after we saw water bottles being dropped off down the street and the dispensers. So I'm just wondering if there's any plans to test the area I'm in, because we looked online and we went through the website for testing, and it's like $300 to have your water tested. I'm sure everybody's experienced that. Is there any relief for that? Because now we have to do this. And if I'm in the gray area there, that's not marked, does that mean people were tested, or it just has not been tested in my area?
And Mary Jude, I'll just piggyback on that. We have a lot of questions, confusion about how the bubbles work and how that process.
So what Andrew's referred to as bubbles is what we would be doing normally. That's when we started. This is we take the first one and we draw 500 circle around it. We sample the wells and then we do 500-foot circles. Very clearly, these bubbles got out of control, and we abandoned the bubble process, and we looked and said to see the Emory Road neighborhood was way further than 500 feet, but lots of the property, we added that to the sample immediately. The gray area is what the LSP, the gray parcels on the map, or what the LSP has identified as in the next rounds of sampling. What was your address?
I'm 164 South Ashburn. I'm at the north end of Crocker Pond, but my property is unique that I have water that flows to the west, and I have the water that flows to the south. So I'm right on the corner, and I'm just worried because Crocker Pond being closed, and we're right on the beach, and nobody told us. So.
You can find it. It's about 4 from the end.
We got it. We're going to test that. It's not money.
Was it before?
It takes a minute to pop up.
It's way toward, it's way at the end. 34, thank you. I went the wrong way. Apologies. Okay.
Right in the corner.
Mary Jude, do you want
That
the-
water goes right to the right at the north end. I'm right on South Ashburn.
Yeah.
So,
We were just looking at the map today. I apologize for going much.
and we're one of 4 houses that are on Crocker Pond, and none of my neighbors were told either. That there was an issue that literally have houses right on the water. And we have dogs that swim in the water. We have, kids and everything, so nobody was told.
Just to be clear, there's no sampling from Crocker Pond yet.
Okay.
Crocker Pond sample was taken, and we hope the results will be back on Friday next week. We consulted very carefully with DPH because it is a recreational water body, and DPH has specific ways of sampling from beaches for that. We had, I don't know, 3 or 4 page protocol that DPH provided to us to give to the LSP to make sure the water sample for Crocker Pond is taken exactly the right way in exactly the right
But
place.
as soon
So
as there
that's
was,
fine.
I'm sorry, but as soon as there was a concern, the people that are actually on the water should have been told. So we didn't know, even that weekend, so Memorial Day weekend, we were ready to go out on the water, and nobody told us.
I thought there was a code red from the town.
No.
No.
I'm sorry.
The code red did go out, but not everyone is registered for the code red. And how every individual actually does make himself, you go to the Westminster website. They don't know who's contact, because everyone uses cell phone nowadays.
Oh, that's helpful to know.
I pinned the link on the Facebook page, so if you go to featured posts, you'll see the link to that.
We can put a Facebook page up there, so if I'd like to join it. Yeah. So, but thank you. Thank you for your time, and I appreciate this opportunity to voice our concerns. Thank you.
Thank you for the reason.
Hi, I'm Katie Kaminsky from 7B Porridge Hill Road. Thank you for doing this meeting tonight. It's helped a lot. And my question is, when we get our water tested, what is the level, like, let's say when we get our results, what's the alarming level? we might have already gone over it, sorry. If we get an alarming level and we have to do the POET system, what about we just put in a water filtration system 2 years ago and spent like $6 grand? Can you help me with that? How does that affect, if we even need it, we might not.
Sure, I'll talk a little bit about the first part of what Mark explained about putting the POET system in.
Okay.
The level that we've established in Massachusetts for drinking water is 20 parts per trillion.
Thank you.
So it's 20
Okay.
is acceptable, 21 is not.
Thank you.
So that's the number. The POET systems are being installed, taking into consideration other things people already have down basement.
Okay.
With water softeners, and there's an order in which the treatments have to be put with each other.
Right, so what type of treatment do you have?
We have the Culligan water filtration system in our house for hard water. So we have a
Water
private
softener.
well.
Oh, water softener.
Yes.
Central regional students here.
Rachel.
Larry will come to your house and his team, and he will assess your basement and look at the entire filtration system that's there. And they'll determine where they sample. They're most likely going to sample before the water softener. It's really at the pressure tank, which is the closest spot where the well comes into the house. You know, that's the spot, assuming that it's a spot where they can collect the sample. If it's rusted, corroded, then they're not going to collect the sample there. They'll go to like the next spot out from that. But every house is different. Everyone's put on water softeners or POET systems or something like that. So it's really like an individual inspection.
Okay. Yeah. All right. Thank you.
So I thought you guys could turn out the lights on us back there. We told the superintendent we needed the room until 8. So are there
Maybe a
lot of
couple more quick
still?
questions. I'm sure everybody's.
Yeah,
here
no,
for
I
a
know.
reason,
And so just checking with Andrew, are there a lot of questions still on the Zoom?
So,
Maybe give it another 5 minutes.
Yeah, thank you very much. Jeremy Roach, 3 Woodland Drive, one of the pink ones there. And yeah, I think this is an important meeting. Obviously, maybe like this woman said here, maybe another meeting. We appreciate the information, certainly. 2 questions. So what is the process to be notified about installation of one of the mitigation systems, the point of entries? Because communication seems like it's happening in lots of different ways, but no clear way. Like I'm hearing about weekly reports. I've never heard of that. I know there's a Facebook site. I heard about it word of mouth myself. Got the Connect Ed about a week ago, you know, the message that comes over the phone. And I guess I had signed up for the code red. I don't remember doing that. And then like Mark said, you know, water, potable water is a necessity, not a luxury. So what is I see there's like a 5-year process for this. What's the likelihood of timeline for access to town water? You know, because I think that's another factor that's obviously very important. Because I got a C- in chemistry in high school, but I'm guessing without knowing much about this, that this doesn't flush out after 2 weeks. Those PFAS are going to stay in the well for a long period of time. And I don't know what the shelf life, so to speak, is, but guessing it's more than 2 weeks or a month or something like that. So I think access to the town water supply, you know, getting connected to that is a question I would have. I don't know about anybody else. And again, thank you for the information.
Sure. So as Mark Baldwin was explaining, the immediate task is to see where the contaminated wells are. We can't really do anything more until we've defined who needs clean water. So that's this immediate response action. The chart that Mark had about all the different steps that happen in the process, that comes after you've identified all of the exposures and have mitigated those exposures. A lot of people have been asking questions about the water line. Water comes from Fitchburg. It's not Westminster's water, it's from Fitchburg. We have 4 bureaus in MassDEP. Having Andrea, Mark, Doug, there are 3. Our 4th deputy regional director is the water programs. She is not here because she's not working on it. Her team is working on it. We've reached out to the DPW in Fitchburg to make sure that they would have sufficient water. We don't know how much water, because we don't know how far the contamination is gone. We don't know how far the water line would have to go, because we don't know how far the contamination is gone. We don't know if there would need to be pump stations. It's hard to design a water line when we don't know where it needs to go. We reached out to Fitchburg and said, could you sell another 100,000 gallons of water a day? The answer was yes, definitely. How can we help? So the town of Westminster has an intermunicipal agreement with the city of Fitchburg to purchase the water. That has nothing to do with DEP, but we're trying to figure out how quickly could water happen if expanding the water line is a feasible solution, which we think it probably will be. Still, we're focused on identifying the exposures right now. So the town and the city would need to get together, drag that agreement out, see if there were changes necessary, and maybe there are. Maybe it just is open-ended, and Fitchburg can sell Westminster as much water as they want, and it can be done lickety split. I don't know what the answer is, but there's definitely a process, and you're not having to create it from scratch. There's already an agreement that allows them to sell water. The pipe is all the way there. The things that are hatched in blue are on the public water already. It's quite an elevation change out there, so there will be pump stations involved, I'm sure. It's going to cost a lot of money. PRPs are going to take more. Keep that in mind.
I'm in this college at 137 Dean Forage. What happens if they run out of money?
I don't think they will. I think that there are enough of them on the list that we've seen, people over 35 years who brought material there that may have contained PFAS, size of some of these companies. They don't normally say something as unequivocal as the PRPs will come forward. PRPs will.
So my next question is, once we do get these POET systems in our house, the filters need to get changed. Who's responsible for the filters getting changed and the cost of that?
PRPs.
Thank you.
Potentially responsible.
She had asked me to save the rest of the questions to just forward, but this is my last question. I'm John Miller, 227 Bean Porch Hill Road. I'm that house due north, that red one there. We talked to Larry yesterday. We got our results back. I'm shooting 95 on the parts per trillion. The only reason I got that tested, I contacted Larry because I was contacted from a friend letting us know that, hey, you know, all the people on the golf course, all the wells are contaminated. Maybe you should get your well checked out. So we did, and we're rocking a 95 way over there. And it's like the 500 radius. I realize you stop, but everybody's talking about the communication. They, you know, how about like passing out flyers to the neighbors, knocking on doors? Hey, maybe you shouldn't drink your water. This is. I have young kids in my house. My wife's like, you know, can we get a POET system? And he said that they don't have any to give us. So my question is, when can I get my POET system? And I actually have one more too. All the dirt and stuff.
The immediate response is to get you bottled water. So
We have that, but
so you have clean water, and then the question is, when does the POET system arrive? And we've been told there's 110.
But like showering, kids playing the hoses, swimming pools, stuff like that. Also, the stuff that they're making, you know, people in this whole neighborhood bought dirt and stuff like that and dumped it all in their yards and planted gardens. Me, myself, watered it with my contaminated 95 and had the dirt that grown in my, and ate all the stuff and fed to my kids. So.
Well, and Mark Nascarella spoke to that, and
does that like seep in from the ground, all the dirt, and go into my well?
So they're excellent questions, and I understand your concern, absolutely. So to the extent there's contaminated soil, we would expect that the PFAS in that soil would end up in any produce you might grow. The ability of PFAS to move through soil is so dependent upon many different factors, but you know, the long and short of it is, you know, once if PFAS was in your soil when you applied it in your yard, there's likely still some PFAS in your yard. The extent of that contamination, how much is there, how it might move, are things that are determined on an investigation of your home. Like how high are you above the bedrock? Where is your water moving through your soil?
Steep cliff. That's what scares me. You know what I mean? That this is a hill, that top of the golf course is, that's a hill. It goes down the hill towards my house and down the hill towards the lake. If the contamination is at the top of the hill, that stuff's spreading. It's not like I'm way down there. There's some like yellows and stuff. Maybe they didn't drill deep enough, but how am I at 95 and I'm way up there?
These are really important questions, and it's what the whole process of defining the site goes to. And at some point in another meeting, we'll be looking more closely and saying, well, why is this one yellow and this one's red? And I can tell you, pretty much every site I've ever worked on, there's a whole bunch of houses that are red, and then right in the middle is a green.
But nobody was notified. That's the thing too.
And you just
Like my
don't know
neighbor,
why.
he had no idea. I had to tell him. So like
Well,
maybe the town would do something more to the red alerts. I didn't get that. I didn't get the call. How about like, you know, how about a police truck or a firefighter going down with a pamphlet and knocking on the door and saying, hey, you guys up here, you know, your neighbor's contaminated well. Maybe you shouldn't drink the drinking water. Did you get the message? No, leave it on their doorstep. But I mean, it's probably Board of Health's job to do it, but I've already talked to them and they sort of point the fingers to the DEP is handling all this, so. Just like a neighborly thing, I know everybody's all neighbors, just throw one piece. We're contaminated out here, and I know everybody wants to go and watch Celtics, so thanks for everything you guys do.
That's the real reason.
I do want to say thank you to everyone for coming and just echo that. One final, okay.
Yeah, I am Rick Fisher. I lived in town for over 40 years. I lived right across the road from Chris, probably 40 years, his house, and then now I live on right at the bottom of Beanport in South Ash. My question is, how did we determine that that was Mass Natural alone that's producing these PFAS? Like Mark said, they're in everything. But I'm always curious that the golf course has an 1,100-foot deep well. Has that been tested? Because that well is deep enough, and that every green on that golf course used Mass Natural dirt. So why is Mass Natural pinpointed only? Or is there other things going on that we should be known about? Because that seemed like a concern to me when you have an 1,100-foot well, and everybody else has 100-foot here and there, and their wells are coming up contaminated. How about test a 1,100-foot well? Give us an idea if there's more going on than just that Mass Natural.
But we think Mass Natural because the level of Mass Natural was 5,737 in the on-site well. So that seemed to us to be the logical place to start. The golf course well was tested and it was 3,200.
So I just want to end the meeting the way that I ended the Zoom to let everyone know that if your question wasn't answered, feel free to reach out to me. My contact information is there along with everyone else. Kind of pick a person and we will definitely get back to you and we'll be in touch. Thank you very much for coming.